Hello, everyone. At the outset, let me wish you a very happy Children's Day. And this webinar is specifically on the occasion of Children's Day, wherein I'm going to talk about the scope and the vision of pediatric dentistry. I'm Dr. Ashwin Jawdekar, and I have been teaching pediatric dentistry for over 21 years, and I have my clinical practice in Thane exclusively for children. I have been in clinical practice for almost 25 years now. And you can have a glimpse of my biodata over here. A couple of highlights that I want to mention uh, in my career as a pediatric dentist is I have been able to practice dentistry for children in my clinic, that is Little Smiles in Thane, and also at Jupiter Hospital, Thane, MRR Hospital, Thane, as a visiting consultant, wherein I do special care dentistry. I have been associated with the Indian Dental Association for a long time, and I have conducted several courses at the IDA head office. And I also got an opportunity to propose the National No Sugar Day, which is observed on the 1st November in India. And this was at an IDA FDI event in June 2022. So I thank IDA for giving me such wonderful opportunities, this being one of the opportunities that I have cherished. Now, what is pediatric dentistry? As per the American Academy of Pediatric Dentistry's definition, pediatric dentistry is an age-defined specialty that provides both primary and comprehensive preventive and therapeutic oral health care for infants and children through adolescence, including those with special care needs. Now, I'm just going to talk on some key terms in this definition. It is an age-defined specialty, unlike a few other specialties. For example, prosthodontics. It is not age-specific. Prosthodontists can deliver treatments to different ages, and also specialties such as orthodontics, prosthodontics, or restorative dentistry. They are technique-specific, or procedure-specific, or skill-specific. In pediatric dentistry, we are not defined by a certain skill or a certain technique. We are basically the dental caretakers of children, as one can say. Now, the next key term is primary and comprehensive. So basically, what is primary care? Primary care is any care that is accessible and affordable. So basic care that children deserve. For example, in India, about 50% children suffer from dental caries. So in my opinion, some basic care such as topical fluoride varnish application or pit and fissure sealants or basic restorative care and extractions, that must be accessible and affordable to masses. And what about comprehensive care? Well, comprehensive care can be more than that, some aesthetic treatments. So it could range from the basic primary care till advanced care, say zirconia crowns or some cosmetic procedures, aligners. So those things could not be affordable to everyone, but in a comprehensive care package, they could be included. Then the next terms are preventive and therapeutic oral health care. So preventive care, I have already mentioned a couple of examples like fluoride applications or sealant applications. And therapeutic means the treatment procedures that we deliver for infants and children adolescents. So here is the age range that we cater to. So we begin treating children as soon as they are born. Yes, sometimes there is a natal tooth which is present, or sometimes there is a cleft lip or a palate that is present, and pediatric dentists have to look into these problems also. And we continue treating them through adolescence, that is almost till the age of 18 years, because after that they cannot be called as children, including those with special healthcare needs. So basically, what are special healthcare needs? Any children who have certain medical challenges, or if they have certain systemic involvement, for example, children having cardiac problems or epilepsy, or children having cerebral palsy, Down syndrome. These are a few examples from intellectual disability or some kind of a disability. Now, I want to tell you that the scope of pediatric dentistry that I mentioned just now is not only for pediatric dentists to cater to. So basically, pediatric dentistry can be practiced in various setups, in various settings. So pediatric dentists could have their exclusive setups wherein only children will receive treatments. Pediatric dentists also visit many general dentists, and they provide care as visiting consultants in the general dentist clinics. Pediatric dentists are also based in hospitals. As I mentioned to you earlier, some children, they require hospital-based care because of their disabilities or because of the certain challenges. Also, general dentists can provide care to pediatric dental patients, and I believe that the onus of treating children is going to be on general dentists for some time now, because as I mentioned, there is a lot of unmet treatment need, because about 50% children have caries, about 15 to 22% children, they have traumatic dental injuries, about 2 out of 3 or 3 out of 4 children have some kind of developing malocclusion or deleterious oral habits. And about 10 to 15% of children, they have hypomineralized teeth. With such huge need and most of the need being unmet, there is a huge potential and necessity for general dentists to provide good pediatric dental care to the patients. Also, dentistry for children can be practiced in certain public health settings, such as school clinics or community dental clinics, which is not a commonplace thing in India. But yes, this is one opportunity that's likely to serve a lot of children. So, what does dentistry for children mean? To me, it means treating a child and not just a tooth. It also means treating a disease and not only the lesions. So if we look at dental caries, we are not interested in only drilling and filling the cavities. We are interested in preventing caries, and we are also interested in managing caries less invasively or with minimal invasion. Also, pediatric dentistry means comprehensive treatment planning, not just being a problem solver for the temporary problems. For example, if a child comes to me with pain in a certain tooth, and I look at only that tooth and treat that tooth with some endodontic treatment and a crown, and do not address the other issues which come to my notice, such as some other carious lesions or a deleterious oral habit, or maybe a tongue tie which is present, then I'm not providing comprehensive care. Pediatric dentistry requires administering local anesthesia with confidence. And I feel that this is a key to successful management of children, because child management, that is child behavior management, and pain management, they go hand in hand. So always, for any potentially painful treatment, if local anesthesia is delivered well with confidence by the dentist, and if the child has accepted that local anesthesia, that means half the battle is won. Another thing related to pain management is prescribing medicines with proper dosage calculations. So as a part of training, I really subscribe to training my students on proper dosage calculations, because this is a very, very important aspect of pediatric dentistry, because children are physiologically different. They have to be prescribed medicines on the basis of their weight and in a proper manner. So that's what is pediatric dentistry. Now, often as dentists, we look at teeth and we look at the jaws. But one of the under evaluated aspect of oral care is assessment of muscular function and retraining of muscular function. So basically, correction of functional disorders such as mouth breathing, tongue thrust, or deviate swallowing, and re-education of orofacial muscles, we call it orofacial myotherapy, is one of the important aspects of dentistry for children. And lastly, now when we manage children, I hear this from a lot of dentists that sometimes children may consume unpredictable time in the dental chair because of their lack of cooperation or because of their unwillingness to get the treatments done. So with good understanding of child behavior management, we should work not just effectively, but we should also be working efficiently. That is, in a time efficient manner, we should be able to deliver treatments. That's what is dentistry for children to me. So I would like to address three aspects of pediatric dental care in my treatment planning. First aspect is whenever I see a child with, say, carious lesions in 15 out of 20 teeth at the age of 4 years, I look at the clinical picture history as well as if a radiograph is available, the radiograph, and then I plan the treatments. They could range from, say, simple restorations, extractions, sometimes space maintenance, sometimes pulp therapies, crowns, etc. Then the second aspect is preventive care, which has both aspects, that is home care as well as office care. So in the home, a child must brush twice a day using age appropriate toothpaste. That is above 6 years, we recommend a regular fluoride toothpaste, and below that, we recommend a junior fluoride toothpaste. And below 2 years, sometimes we recommend a non-fluoride toothpaste. Also, above 6 years, I prefer prescribing a fluoride mouth rinse also, since toothpaste in India have only about 1000 ppm fluoride. An additional mouth rinse could help mitigate the caries risk if it is high. And in the office measures, we suggest some things such as fluoride varnish application, pit and fissure sealants, oral prophylaxis, etc. Now, child management is an integral aspect of pediatric dental care. So, if we plan a comprehensive treatment, first two appointments have to be given for child behavior assessment. And based on the child's behavior, we should set a protocol of child management. So, now the child could be absolutely uncooperative, or and if there is an emergency type of care required in the child, probably a hospital-based care is a good approach. However, such possibility is rare. Usually for pre-cooperative children, that is below 4 years of age, or children with some special needs or emergencies, hospital-based care may be necessary. However, children who can potentially cooperate in a dental clinic and they present with uh, problems which are not of absolute emergency nature, we try to modify the child behavior and we try to carry out treatments in a stepwise manner. That means in the first couple of appointments, we could start with simple non-invasive procedures such as, say, fluoride varnish application, carrying out oral prophylaxis, or simple excavation and restoration. And then we can go further and complete treatments under local anesthesia. We could prefer keeping some traumatic procedures such as extractions a little later, and try our best so as to minimize the trauma associated with the procedure. Child management requires several approaches such as tail shodo, modeling, and the reward oriented management. That means children get gifts from us on accomplishing treatments in a successful manner if they cooperate. So these are some of the strategies that we use for achieving good child cooperation. Now, I'm just going to demonstrate a couple of treatments just to give you an idea of the spectrum or the scope of pediatric dental care. So, in this 7 to 8 year old child, we found that there were quite a few teeth decayed. The child's dental age is 7 to 8 years, as we can see. So, he has mandibular incisors and maxillary central incisors, and he has also first permanent molars. This child had a gag reflex and he had a history of gastritis. So, I mean, that was also required to be considered while prescribing him. Now, this OPG shows that some of his primary molars were really badly damaged, and even there was a root resorption in case of mandibular first molars. So, first we prescribed the child, and since he had gastritis, I avoided ibuprofen and prescribed him only a paracetamol syrup. And you can also see that because of his caries risk, I have prescribed him a fluoride mouth rinse. I gave him ondansetron syrup because he had a gag reflex, and sometimes that mitigates the vomiting, and it comforts the child. I also assess the child's risk. If you see those four squares over there, they are for the assessment of caries risk. We have a tool known as Craft, which is a free Android app. I will speak about that a little later. So that Craft approach to caries management can be considered for better patient engagement and explaining them better about the preventive care. And you can see a diagram of a tooth that I have drawn just to explain them the spread of infection and what different treatment modalities would be necessary for different stages of a problem. So this is the entire treatment plan for this child. As I mentioned to you, there are three aspects of it: treatment procedures required, preventive measures required, and visit-wise protocol based on the child management. And you can see a couple of question marks also in the treatment procedures, because sometimes just on the basis of history, clinical examination, and radiographic examination, we cannot finalize a treatment plan. We need to actually finalize it at the time of doing treatments if there is a doubt about the pulpal status of a tooth, for example. So for this child who had extensive caries in primary dentition, I can show you how we completed the treatments with restorations, pulp therapy, sealants, crowns, and even space maintainers, crown and loop space maintainers. So you can see here that there is a pre-treatment OPG and a post-treatment OPG with all treatments completed. And this is a follow-up set of pictures for him. So this shows how the treatments have helped. In this picture, you can see that now 1/4 has started erupting as well. So this was a treatment completed of a patient with caries in a mixed dentition. Now, there is another problem that we come across very common is a certain deleterious oral habit. So this was a 8-year-old child with a lip sucking habit, and he has a lot of functional problems. He is a mouth breather, not a nose breather. You can see that his nose is collapsed, and I mean the nostrils are not fully dilated. And if we look at his face is conical. That is, it is the upper third of face is okay in terms of its height and width. The middle one is shrunk a little, and the lower third of his face is smaller, both in height as well as in width. And this could be because of the lip trap, because of the reverse swallowing habit. That's why his chin is also retruded. He has a convex profile. So we assessed the functional aspect. So we assessed the jaw development related aspects. So LATSAFE helps us in understanding the jaw growth, and the OPG helps us in understanding the pattern of eruption of the teeth. So we started treatment with orofacial myotherapy for him. So we trained him to do a few exercises. Initially, we gave him an oral screen appliance for 6 months to improve his nasal breathing and also to train his lips and also to stop the reverse swallow, the pressure of mentalis, the hyperactive mentalis on the chin. And later, we gave him a simple myobrace appliance. So this was quite a non-invasive approach. And we can see that in a span of less than 3 months, his lips became competent. Now his face is also developing better. It's looking a little broader. And also, if you have noticed, his posture, the head posture is also better. Now it's more upright. Of course, in such a short period, you cannot see much changes in the dentition. But as we go further, in the next few slides, you will see that his face is changing. Now you can see that his nostrils are dilated. That means he's become a nasal breather. Lips are competent, and the jaw arches are widening. So this was possible just because of this small appliance, that is oral screen, a simple appliance which he wore for about 12 to 14 hours in 24 hours, about 2 to 4 hours in the daytime and overnight. And about 6 months later, you can see that his arches have become a lot better. Earlier, he had a huge deep bite. Now that is also getting relieved. And in 6 months, his face has also changed drastically. So he has a much straighter profile now with better lower third facial development. So we continued with a myobrace appliance, that is a trainer myobrace system appliance. And again, he wore it for about 12 odd hours in a day, including, I mean, about of which 8 to 10 hours were the nighttime wearing. And now you can see that the arches have really widened. The lower incisor crowding, which was present earlier, has almost vanished. And about 2 years later, we can see that he has fully developed arches. Now look at his face, look at his dental arches, the relationships of teeth, and there is almost no malocclusion that is present. So this kind of a non-invasive treatment plan could also help children a lot. Now, I don't have much time. I just want to tell you what is the broader vision of pediatric dentistry and what is the, shortened, you can say, the one statement vision of pediatric dentistry. So we know that pediatric dentistry is an age-defined specialty that provides both primary and comprehensive preventive and therapeutic oral health care for infants and children through adolescence, including those with special needs. However, the scope of pediatric dentistry is much broader than what is stated in this AAPD definition. In pediatric dentistry, we identify and modify markers and risk factors for health concerns over a life course perspective. For example, when we witness early childhood caries, that's the first manifestation of sugar load that we identify, and we can provide dietary counseling for sugar addiction, which can help not only in decay prevention, but also obesity prevention and prevention of a lot of non-communicable diseases. Also, I showed you a couple of cases in which how mouth breathing had become an issue, or the functional problems had become an issue for jaw development. So when we correct these issues, that is, we correct breathing, mastication, swallowing, it improves not only the jaw growth, but also the overall health. Pediatric dentists have a very vital role in sports safety and forensic science. Children, when they are learning to play sports, they have to be playing sports in a safe manner. So we can provide them mouth guards. Also, if they have increased overjet, that means a trauma-prone profile, we can correct that also at an early age. Then pediatric dentists have been engaged in a lot of community outreach programs. So one of the examples is a Fit for School program, which is underway in Philippines. And a similar program I had also suggested in one of the documented papers of mine on oral health promotion in children, which was published in International Journal of Dentistry in 2013. And as I mentioned in the beginning, the National No Sugar Day, a symbolic day for identifying the risks that sugar poses to our health, is a contribution of a pediatric dentist, that's me. And in general, when we treat children, we save teeth, we protect teeth, we prevent them from getting damaged. This instills a positive attitude in a child about dentistry. So as pediatric dentists or as dentists, if we provide good care to children, they become positive about receiving dental care. So in general, we can give children an experience which is beyond their oral health and which can make a significant impact on their quality of life. So in short, the vision of pediatric dentistry is we want each child to breathe well, eat well, sleep well, grow well, play sports safely, have a good posture, and a healthy smile. Now, I'm just sharing a few things that I have been able to do as a pediatric dentist. I mentioned to you about CRAFT. This is India's first caries risk assessment program for children. And this has been published a lot and cited by many other publications also. And if you scan the code, this is a free to download Android app that's available for anyone to use. We've also developed a novel sugar meter to quantify the sugar exposures through a diet diary. And also there is an app for dentists that can help them make pediatric dental prescriptions easy, the Prezi app. And this Prezi app was an award-winning app, and this helps calculating the drug dosages when it comes to writing a prescription for children. And it makes also a PDF prescription ready in just about 50 seconds. So for this innovative work, we had received an award at the National Oral Health Innovation Conclave that was organized by IDA in New Delhi. So these are a few glimpses of the FDI IDA workshop, which I mentioned to you earlier, in which I had proposed the National No Sugar Day. And this National No Sugar Day made a huge impact nationally as well as internationally. IDA had conducted a competition in which some 14 dental colleges had participated. And in the college campus where I teach, that is Bharati Vidyapeeth Dental College, we had conducted several activities on No Sugar Day. And the National No Sugar Day is also endorsed by our ISPPD, that is Periodontic Society. And also it has been endorsed by several government and non-government organizations, professional bodies, etc. So these are some things about the National No Sugar Day. FDI published this on their website that India observes its first National No Sugar Day as a result of Mumbai Declaration. So this is the screenshot or the scan code of our craft app, the Prezi app. And if you want to know more about the National No Sugar Day. Now, I just want to tell you a little bit about the fellowship program that Indian Dental Association is running in their head office in Mumbai, which is open to general dentists and even to pediatric dentists. So this was the first batch of the fellows who completed their fellowship in just last week. So it's a 6-month long training program, and the manner in which it is conducted is hybrid. There are 3 modules with 2 days of face-to-face interaction in each module and approximately 10 interactive online sessions. And there are a lot of lectures, videos that I share, and hands-on training is provided. And a lot of one-to-one mentoring also for pediatric dentists. I'm a chief guest faculty for this program, and there are other guest faculties also. So this is at the time of convocation, which is conducted at the IDA head office. And I'm just sharing with you a couple of testimonials of the fellowship students. So general dentists, if you are interested, you can sign up for this program. The second batch is already announced and it is fast filling. By the end of this month, probably the batch strength will be met with. So I had started this program earlier at Maharashtra University of Health Sciences while I was teaching in YMT Dental College along with my colleague Dr. Amar Katre. So since 2019, this fellowship program has been in place. Earlier it was in MUHS in a dental college, and now Indian Dental Association also runs this fellowship program in pediatric dentistry. So I thank you and I thank IDA for giving me this opportunity to give a webinar on Children's Day. I wish you and all the children a happy Children's Day again. Thank you.